Thank you, Dr. Devi. Thank you for inviting me for this session, and I'm fortunate that you gave me this opportunity. And okay, today's topic is case taking in acute and chronic diseases. Okay, so
Yes, ma'am.
first we will start. What is case taking for juniors? Case
Oh,
will start with what is case taking. Okay, so
yes, ma'am. Yes, yes.
for juniors, case taking is systematic process of gathering the information of patients. Okay, so information of patient, from his attenders, and from our observation and from our perception. Okay, so this is collectively known as case taking. Okay, so according to Elizabeth, as we all know, well case taken is half cure. Means if you are taking a case very well, then half of the your problem is means solved. Means you can differentiate the medicine from case taking only. Okay, so we will start how to will take the case in acute diseases. Okay, so in
Yes, ma'am. Very true.
acute disease, we should not means if patient coming into a clinic, patient is suffering from acute disease, means already he is in pain. You should not ask further thoroughly deep questions and what is your family history, what is your past history, and no need to ask about that in acute cases. Okay, so acute cases means patient is suffering from any condition since 2 3 days, 4 5 days. Okay, so in this condition, for example, patient is suffering from fever. So only you should ask, since when you are suffering from fever, means from 3 4 days. So ask about thirst. Okay, how much water you are drinking. Okay, so if patient tell I'm drinking sip by sip. Okay, so you can differentiate the medicine. If patient is patient is drinking sip by sip water, then you can think of arsenic alcohol. Okay, if patient
Okay,
is
ma'am.
no, I'm drinking lot of water at a time, so you can think of bryonia. You should differentiate in this type. Okay, now you can ask what are the modalities of your conditions. Means if patient is suffering from fever, you should ask, are you better by pressure, or you are frequently you are changing your positions. If patient is frequently changing his position, it means he is restless. So you can think of rest talks. But patient is better by rest, better by pressure, is not changing his position and drinking lot of water. You can think of briny. Okay. Other cases of acute disease like patient is suffering from diarrhea. For example, patient came to your clinic, you should ask the history. Had you ate any outside food? Had you any travel history
Okay.
and something? Okay. So if patient coming in a clinic, so remember one thing. In acute cases, you have to learn therapeutic first. Okay. Don't go in the miasmatic medicines, constitutional medicines in acute disease. Okay, go for therapeutic first. Okay, in diarrhea condition, patient is suffering from diarrhea, so ask them, are you feeling cramps in your abdomen or painless diarrhea? Okay, so patient is that I'm not having any cramps in my abdomen, only diarrhea, painless diarrhea. So you should think of natrium sulf 1 m and then podophyllum 30. If patient having complaints of cramps as well before and after stool and before stool or during stool, cramps in abdomen, so you should think of colosine. Okay.
Okay, ma'am.
Likewise, in cough cases, when patient is suffering from cough coryza since 3 4 days, okay, patient comes in your clinic, I'm suffering from cough. So you should ask, since when you are suffering from cough, is any history of means fever, yeah, something else, something URTI or like this. So you should ask. Since when and yeah, are you feeling better by drinking water or are aggravated by water? Hmm? Ask this way. So if patient is better by water, better by drinking water, you should think of spongia. Okay.
Okay.
And if patient is not better by water and is aggravated by eating and aggravated by drinking water and cough with vomiting, so you should think of Kalicar. Okay. And most of cases, Calibicrom is the best medicine in cough cases. Dry cough with slight expectoration, which is sticky, white, and difficult to expectorate. Okay, so you should think of Kali carbon, Kali bicrom, and Kali bicrom patient. When you examine their throat, so there is bubble form in the throat. Okay, so you can give Kali bicrom. Okay, likewise, if patient is aggravated by talking on phone, talking loudly, so you can think of Drosera. Likewise, this is as easy as means you can don't mess the things, don't confuse the things. Okay, you can remember the therapeutic in acute cases and give the medicine. Okay, now we will further we will start the chronic cases. In chronic cases, how to take case history. Okay, in
Yes,
chronic
ma'am.
cases,
The
when
most difficult.
sorry.
Ma'am, the those most difficult thing, chronic cases.
Chronic cases is very difficult. Yes. In chronic cases, your case taking is start as soon as patient enters in your clinic. When patient enters in your clinic, you should observe the patient, how patient is looking like, how patient is working, how patient is talking to you. Means patient is anxious, restless, nervous, how he is giving expression, okay, and how he is talking to you. Some patients start their history before you ask their name. Okay, so these patients are very nervous, very anxious. So you can think of
Yes,
arsenic
ma'am.
album, argentum nitricum, lycopodium. Okay, how patient is sitting on the chair, patient chair. When patient is sitting on the edge of the chair, he's not means comfortable. He's sitting on edge of the chair means he's very restless. He's very anxious. So in this case also you can think of arsenic, lycopodium, argentum nitricum, this type of and Celicia. Okay, Celicia patient also nervous. And if patient is sitting arrogantly in front of you,
Okay.
okay, so you can think of platina, you can think of thuja in these cases. Okay, if patient, especially female, sitting with cross leg, everyone knows sepia may be the medicine. Okay, after you ask name, age, and then ask about occupation. Okay, occupation is the very important thing in the chronic cases. Why? Because many medicines are related to occupation. Okay, like one patient is came into your clinic with history of cough. Okay, you must ask what is your occupation because means some diseases like silicosis, bichinosis, like other COPD, and all the diseases are related to occupation. Okay, when patient is working in the cotton factory. Okay, cotton factory is the main cause for bichinosis. Bichinosis means inhalation of cotton fiber in the lungs. Okay, this is not the acute disease. It takes several years to develop the disease. Okay, so you must rule out because after asking the occupational disease we can remove the maintaining cause. Okay, maintaining cause we all
Exactly.
know. Maintaining cause we all know that the cause which is able to maintain the disease throughout your life. Because after, if you are giving the medicine, your well selected medicine you are giving, and you are not removing the maintaining cause, then the medicine won't work. Means medicine will work, but if
Exactly.
cause is maintained throughout their life, they won't get relief. Okay, so you need to ask the occupation. Means some disease like varicose vein, plantar facialis. These are the mainly known as policeman disease, varicose vein. We all know. Okay, because they are standing throughout the day. Okay, so this cause because of gravity and because of they are standing all day, so they will more prone for varicose vein. Okay, and varicose vein we can give pulsatilla 1M and Esclor 30 wonders. Okay, give wonder results in varicose vein. Okay, after plantar fasciitis is also known as policeman's heel syndrome because policemen are standing all day. Both diseases
Yes,
are
ma'am.
related to policemen.
Job profiles.
Okay, yes. So you can think about this. And plantar fasciitis you can give when plantar means whole heel pain and that sole is paining. Okay. So in these cases, you can give calcareflor 1M and phytolitha 30. Okay. This is the best medicine for plantar fasciitis. If patient complaining
Okay.
of only heel pain, pricking pain, you can think of Lidempar. Okay. And if patient complain only first step is painful, after that I'm all right. So sulfur 1 mn, phytolitha 30, ruta 30, acetylode 30, whatever medicines are similar to the disease, you can give. Okay, after occupation, you should ask chief complaints. Okay, chief complaints means which disease you are, which disease is affecting to you. Okay, so if patient is telling I'm suffering from RA, joint pain, so you must ask how it started. Okay, means whether you first affected hip joint, knee joint, or shoulder joint. Okay, if patient is telling this is order is ascending order, means first knee joint affected, means first heel affected, then knee joint affected, then hip affected, then my shoulder got affected. So in this case we can think जो ऊपर से नीचे की तरफ वो नीचे से ऊपर की तरफ जो symptoms आते हैं, you can think of lead and path. Okay, and
Okay.
opposite condition when symptoms are going downward means first shoulder affected, then back pain, then hip and knee joint. So you can think of calmia. Okay, ask this way and differentiate the medicine. Okay, now after chief complaints, you should ask the associate complaints. Some patients like suffering from joint pain, and then they also complaining of heart symptoms like rheumatic heart disease. So you can think of calmia. Okay, this is the associate complaint. After that, we
Okay.
take the history as a whole. Okay, take the history in short. In short means observe more, ask less. Okay, use ask one question and observe the things. Okay, you ask what is your desire. Okay, desire is the main thing. So ask what you like in food. Okay, if patient tell I like sweets, so you can think of sulfur, glyco, argentum like you can think of this. And if patient tell no, I like salt more, so you can think of natrum more. You can think of argentum phosphorus like this. Okay, if you ask patient what do you like and he says I like potato, don't ask like do you like potato? Yes, I like potato. No, not like this. Patient will tell you
Direct
I
question.
like potato. Okay, don't ask leading questions. Do you like this? No, give them a choice. Do you like spice more, no, spicy more? Do you like sweets more? Do you like salt more? Like this. Okay. So if patient tell I like potato more, think of alumina, think of natrum tar. Okay. So practice this way. And if patient tell I like tomato more, so ferromet is the medicine. So you should differentiate. You can differentiate when you are taking the case. Okay. After that, you can ask aversion. Okay, what things aversion means not that I don't like this, no, because nowadays children will tell I don't like any vegetable. So this is not the aversion. Okay, so aversion means anything which is aggravate the symptoms. Means if a patient telling I'm getting diarrhea after taking milk, so carb is the medicine. This is the aversion. Okay, after I'm getting skin eruptions, I'm getting asthma, I'm getting means aggravation with the condition after taking sartans. CPI and anti-inflammatory is the medicine. Okay, so remember one thing: CPI also likes sartans, desire for sartan, and as well aggravate by sartans. So differentiate the things and differentiate the condition. Okay, so after aversion, you ask thirst about thirst. Okay,
Okay.
ask them how much water you drink in daytime. Okay, so they will tell I means I feel very thirsty. Even at night also I used to drink water. Means very much thirsty patient is Bryonia or Marksol. These patients are very thirsty. Okay, arsenic album is also thirsty, but they will drink sip by sip. Okay, but
Okay.
mark salt patient will tell you, I can drink 8 9 liters per day, 10 liters per day. So you can think of mark salt and the brina as well. Okay, and then differentiate the medicine. Okay, and patient tell I'm not thirsty as well. पानी पीना चाहिए इसलिए मैं पीता हूँ. Otherwise I'm not thirsty. So you can give pulsatilla, nux moscata. These medicines are thirstless. Okay, after that you should ask about appetite. How's your appetite? So patient will tell means I'm not at all hungry. If patient tell I'm not at all hungry, so you can think of chelidonium. So chelidonium is basically a liver tonic. It will increase the hunger. Okay, so you can give picric acid is also not getting hunger. So you can differentiate. And if patient is, I'm very much hungry, but I'm not getting means weight and I'm not healthy still, but I'm very much
Okay.
hungry. I'm eating all the time. So you can think of iodine. Iodine is a medicine where patient is very much hungry. Okay. And soranum is also hungry. Lycopodium is also hungry, canine hunger. But lycopodium patient can eat small food at a time. Okay. But
Okay.
lycopodium and phosphorus patients can eat after eating. Means they are eating fully, but after some time they can eat again. Okay. So you can differentiate like this. Okay. After that, you will ask about any habit or addiction. Okay. Habit means any bidi, cigarette, and any alcohol and any things. If a patient is much addicted to alcohol, you can give Aserum, Naxomica, Quercus, and these medicines you can give. Okay. Now you can come on the urine history. So you must ask that how much means if you're getting burning urination, dribbling urination, involuntary urination, and bedwetting, like in children cases. So if patient is yes, I'm getting frequent urination in every 15 minutes. Okay, so you can think of lilium tick. Lilium tick is the medicine when patient is getting frequent urination. Okay, and in especially in female patient, and in male patient, when patient is getting frequent urination, you must go for sonography, maybe prostatomegaly and prostatitis, and
Yes,
then
ma'am.
you can think of Sebel cellulitis, Haemophila. These are the very good medicine for urine frequency, increase urine frequency. Okay, then bedwetting, if patient is children and suffering from bedwetting, you can think of Medorrhinum manam, Equisetum 30 is the very good medicine for bedwetting. So you can give like this. And patient is old age, not old age, but young patient, old age patient, and involuntary urination. You can think of Causticum and sepia and Equisetum. These are the medicine will help you. Okay, now come on the tool. Okay, you ask about whether you are suffering from diarrhea or constipation or ask them about this. So some patients will tell you that I'm getting, I have to go for toilet as soon as I get up from the bed with rumbling sound. So this is the natrum sulfur sulfur is the medicine. And constipation, we all know alumina, naxomica, sanicula, bryonia, you can give in these cases. Okay, so you can differentiate like this. Okay, after that, you ask about perspiration, how much you perspire as compared to others. Okay, everyone perspire little, but ask them as compared to others, you have perspired more. So if patient will tell, yes, I perspire a lot, means drenching sweat, तरबतर होना पसीने से, drenching sweat, you can think of mug sore. Okay, patient is very much thirsty, very much perspire, large, flabby, and long heighted patient. You can think of mug sore. Okay, Maxol is the medicine. So if patient is
Okay.
drenching sweat, give Maxol. Patient will tell you, I perspire only in underarms. If patient perspire only in underarms, so in female patient you can think of sepia, and in male patient you can think of Natswamika. Okay. If patient will tell, I only perspire on head, only perspire on face and head, so you can
Okay.
think of calcarea carb and cilicia. Okay, so sweating calcarea carb is also have more sweat, but Maxol and calcarea carb we will differentiate like this. Maxol is the
Yes, ma'am.
okay.
We
So
continue.
if patient will okay, if patient will tell, I only perspire on nose, means most of the female patient wipe her nose when she's sitting in your clinic, they will wipe their nose. So you can think of Netramur is the very good medicine for this condition. Okay, if patient is oily nose, not perspire, oily nose, then you can think of
Okay.
pulsatilla. Okay, so if patient tell, I only perspire on upper lips and nose, so Netramur is the medicine for that condition. So you think like this. Okay, then you ask about thermal, how much you are feeling hot and cold. You ask about that. So patient will tell, I feel too hot. Okay, so in this condition, you can think of sulfur medorrhinum. And if patient will tell, I feel too cold. Even in hot weather, summer also, I need to cover myself and I sleep like this. So you can think of Silesia, Sorayanam, Hipparcel. Okay. So ask them, do you keep your feet out of your cover when you sleep? So if patients say yes, then you think of Medurinum, sulfur, and pulsatilla. Okay, these patients keep their feet outside because they feel burning sensation in their soul. Okay, and if patient tell I will cover my head also during sleep, I can cover my head and then only I can sleep. Then you can think of Silesia and Hipperson and Solanum also. Okay, then you ask them about their uh, after thermal. You ask you see tongue. Okay, ask them to show their tongue. You can see tongue. Tongue is a very important key to get a medicine. So if patient have streak on the center, streak on the center or
Okay.
cracked all over. So if streak on center, you can give fluoric acid. If cracked all over, you can give nitric acid. And patient, if patient have mapped tongue, you will see if in clinic whenever you when patient comes you use means make a habit to see the tongue. Okay, if patient have mapped tongue, you can think of netromure and then ask the history. They will definitely tell the history about netromure. Okay, don't ask leading question but ask the history and observe the patient. Okay, now if patient have thick white coated tongue. Everybody knows if patient have thick white coated tongue, then you should give antiproof. Any disease in any condition, if patient have thickly white coated tongue, then all of the disease, whatever the condition, chronic disease, acute disease, the patient will cure. Okay, if patient have thickly white coated tongue. Okay, now if patient have imprints of teeth, imprints of teeth in the sense that tongue have marks, teeth marks on the tongue. Okay, is any disturbance?
No, no, it's my side. It's just a member.
Okay, okay. So any imprints of teeth, you can give mark sore. Okay, so
Yes, yes.
mark
You
sore is
continue.
the you can easily identify the mark sore patient. Imprints of the teeth, large flabby patient, and much perspiration and much thirsty. So you can think of like this. Okay, after tongue, you ask about palm. You see palm. Okay, if patient have dry and parched hand. Okay, hands are dry and parched. You can think of natrium and sepia. Okay, if patient have flabby and soft hands like children, छोटे बच्चों के जैसे हाथ हैं, so in that case you can think of calcarea card. Calcarea card have soft hands. Okay, if patient have large hand with this one is large, flabby, you can think of marks. And if patient have moist, slight moist, not wet, slight moist hand and soft hand, you can think of pulsatilla. Everything okay?
This one.
Okay. Okay. So you can think like this. Okay. Now, if patient have perspire a lot in palms and soles, you can think of silicea. When socks are smelling socks, okay, so you can think of silicea. And one more thing, urine, smelling urine, if patient tell you strong smelling in urine, so you can think of nitric acid and benzoic acid. Okay. Now we will come on the menstrual history. In female, we will ask about menstrual history. Sorry. So if patient will tell, I have 21 days cycle. Okay. 21 days cycle. Every month I get menses after 21 days. So you must think about phosphorus. Phosphorus is the medicine for this type of females. Okay. If patient tell 25 days cycle, okay, 25 days cycle, you must think about calculator. Okay. If patient will tell I have 30 days cycle, so you can think about natrum or sepia. Okay. And patient will tell 35 days cycle with weight gain, curly hair, dark hair, and history of constipation. So you can give graphitis. Okay, graphitis is the medicine. Now, if patient tell I only get menses only one day, only one day. So you can think of sepia and apis. When patient tell I only get menses 1 hour, so you can think of euphrasia and soranum is the medicine. Okay, now we will ask about leukorrhea. In female patient, we will ask, so patient will tell, I get leukorrhea before the menses. If before the menses, it's pulsatilla. If patient tell, after the menses, I get leukorrhea, so sepia is the medicine. Okay, and after patient tell that itching at the genitals, smelling leukorrhea, you can think of creosote. And if bland leukorrhea, you can think of ambragracia. Okay. Ask the history about this, means like this, and differentiate the medicine. This is as simple as that. Okay. Now you can ask about mind. No need to ask about mind. You should observe the mind. Okay. Generally, simply ask that did you get anger? Means if patient is nitric acid, you can see that large luminous is the mostly nitric acid. So they are much angry. Angry remedies are Maxol, nitric acid, and before. These are very angry patients. Okay, they can fight anywhere. Okay, so you can think about this. After that, you ask them. Um, Mind, they ask fear of something. If patient is having fear of dark, you can think of stramonium, you can think of phosphorus. Okay, if they fear of dark, before entering in the room, they have to on the light because of fear. They can't live alone in darkness. So you can think of stramonium and phosphorus as a medicine. Okay, now if patient will tell, I have fear of downward motion and lift, I can't go and lift, so you can think of borax. Okay, and patient will tell I have fear of height, you can think of fusa and argentum nitrica. If patient is means he can't travel in aeroplane because of fear, so you can think of these medicines. Okay, after asking this, ask them the family history, if any cardiac disease and diabetes and rheumatoid arthritis, and ask them the past history, any tuberculosis. So if a patient is suffering from tuberculosis in past years, so you can think of Bacillinum tuberculinum, this medicine. If patient had any typhoid history and this dengue history, and so you should ask about these things. Okay, now you can look at the, means you can observe the patient. So you can start from observing from head to toe. Hmm. So if patient have early gray hair, means in children, where means 10 years, 12 years, patient get gray hair. So you can think of medorinum and kali iode. These are the good medicine for early gray hair in children. But early gray hair in young age, you can think of lycopodium. Okay, so if flocks of hairs are gray, means these flocks are hair, means this in front, like Indira Gandhi, these flocks are hair are gray, so you can think of Soraina. Okay, now if patient have tangle hair, dark hair,
Okay.
and curly hair, you can think of graphitis and Soraina as well. Okay, now if hair are brown hair, silky hair, you can think of pulsatilla, phosphorus, phosphoric acid, like. Okay. Now you will come on the, we will see eyebrows. If eyebrows, less eyebrows, patient have less eyebrows, we can think about calcarea carb, silicea. These are the medicines. When we see eyes, if patient have blue sclerotic eyes, then we think about pulsatilla and phosphorus. Okay. Uh, about eyes, I will tell you, a patient who will never look into your eyes, never ever make eye contact, these patients are black cases. Okay, and the wandering eyes, the suspicious eyes, they are looking for something. They are sitting in your clinic, but they are looking here and there continuously. They are not
Okay.
looking into your eyes. So these patients are suspicious, and we all know suspicious are black patients. Okay, and now we will come into the who are continuously looking into your eyes. The piercing eyes, you will feel uncomfortable. Whether he's child or young patient or female patient, male patient, they will continuously looking into your eyes. Their piercing eyes, we will think of phosphorus. Phosphorus eyes are very sharp and they are very piercing type of eyes. Okay. And now, dreamy eyes. Dreamy eyes in the sense patient is in their own world. They are not here.
Yes,
Okay.
ma'am.
If we ask something, what is your problem and what is your name, they will, huh, like this. Means they are not in here. Phosphoric acid is the medicine for this kind of patient. Okay, now patient is depressed eyes. They are very depressed. So Oramuronate is the medicine, which is
Okay.
very useful in this type of cases. Okay, now we will come on the face. If patient have moles on the face, so much moles on the face, so you can think about acid flow. Uh, you can think about pulsatilla is the pulsatilla also is the medicine. Okay, so some patients have red mole. Red moles are uncommon, but some patients have red mole on their body. So you can think of blepharitis and acid flow as well. Okay, now you see the nose. Okay, nose. If patient have pointed nose, pointed nose with less hair on body, male patients, less hair on body, you can think of acid force. Okay? Acid force patients have pointed nose with less body hair, with dreamy eyes. Okay, they are similar to phosphorus, but phosphorus patients are very sharp, very active, and they'll pierce your eyes, as I told you. And acid force are sometimes looks like phosphorus, but they are not sharp as phosphorus. Okay, and then if patient have large luminous, then you can think of nitric acid and angry look face. Patient is looking angry, so you can think of acid nitric. Okay, and then short flat nose is pulsatilla. Okay, when patient have parrot type of nose, some patient have nose like parrot, means long and tilted. So you can think of antimicrobial. Okay, so these are the things. Then most of female patient will tell, I get pimples before menses. So you can think of Bovista and Pulsatilla. You can differentiate the medicine. Bovista patients will get diarrhea before and after menses also. They have high cheekbone. And Pulsatilla is weeping tendency and mild and gentle, as we know, thustless. Okay. And if patient have pimples only at nose, so you can think of Cilicia.
Okay.
So you can differentiate the medicines like this. Okay, if patient have pimples only at chin, so you can think of antimicrobial. Okay, so these are the small tricks we can differentiate the medicine, and sufficient for today. Ask something if
Yes.
you have any questions.
First of all, thank you so much for ma'am sharing this so much knowledge, so much remedies, like while during acute and both these techniques chronically. Ma'am, it's very hard to remember all the remedies because different of patients come to clinics and they are presenting different symptoms. But definitely there are some remedies as you ma'am described today. So it is direct prescription while patient is giving some history and so there is a network issue.
No, 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 not an issue. And okay, thank you so much for inviting me. And
No, it's my
thank you
pleasure,
so.
ma'am. So I think
And
ma'am,
you
this
are
is
really you
this
are
is
passionate about homeopathy, and you are really doing very great initiative.
thank you
So
so much,
thank you
ma'am.
so much.
Yes. So, ma'am, yes, I think there is no question from audience. So, yes, we'll finish this
Okay,
session here only. Ma'am,
okay.
once again, thank you for sharing your experience, your knowledge with us. And yes, and I hope it's going to really help for us in the practice. And ma'am,
Thank
for
you so
sure,
much.
the next time we'll arrange some other session with another topic with you, ma'am.
Thank you, my honor.